Good morning. Thank you all very much for being here. And thank you to Mike Widmer and to Ben Foreman for all of that detailed analysis. It's great to see so many people here today for such an important issue. So this morning, my panel is on reinvestment. And our panelists, if you would all please come up. Dan Mulhern, Director of the Office of Public Safety for the City of Boston. Chief Ryan from the Arlington Police Department, and Sheriff Steve Tompkins from Suffolk County.
Good morning.
Wonderful. Good morning. I don't know if Cassandra has been able to make it. Wonderful. Well, thank you, gentlemen, for joining us this morning. I think we're going to have a fun discussion here. On the issue of the budget, I know there are numerous members of numerous legislators who are involved in trying to make sure that the reinvestment happens, that the budgets are being watched after. I would say to all of us here, we all have different legislators, and if this is an important issue to you, as someone who comes from the political environment, what I would say is reach out to your legislator. Reach out to your state representatives and your state senators. Tell them that this is important. It's important to have budget line items. It's important for the transparency, because if they don't hear from you, then all of the work that we're doing and all of the work all of you are doing is for nothing. So they are all elected by us, and so for the handful or two handfuls that are doing the work, help them out and talk to your other state legislators. Our panel today is on reinvestment, and research tells us that evidence-based practices can reduce recidivism, prevent crime, and save money. But getting them to work in practice requires real discipline. So our panelists today are going to look at how we build local capacity to make smart investments in a variety of programs. More specifically, and I would like to start this off, and each of you can come up and introduce yourselves and maybe start talking about these topics, but what kinds of practices can keep us safer, and how do we build a culture of data and transparency in order to get the most out of investment in these areas? So, Sheriff, would you like to start?
Good morning.
Good morning.
So after that last presentation, I now know what it feels like to be a human pinata. Let me say this. Clearly, the work that we do on the corrections end is tough work, very hard work, and we are what I describe as the back of the train. We are the caboose. This is where people come once they've gone through the system. As was mentioned, we do need to do a more concerted job in having our legislators understand the difficulties of what it is that we do and what it takes to help people improve their station in life. In 2013, I was appointed as interim sheriff, and it was during budget season. And I went up to the State House to talk to legislators about budgeting because I didn't understand their metrics and how they saw what it is that what we were doing and how they saw how much money we needed to accomplish our jobs. And after about 5 or 10 minutes of listening to them, I asked them, I said, how many of you, and I think I was sitting in front of 7 or 8 legislators, how many of you have actually been to my department? How many of you have been to a sheriff's department? How many of you have seen the programming that we do and talked to the practitioners? And not one person raised their hand. Not one. They had absolutely no idea of what it takes to run a facility. As has been referenced, over 60% of my population is black or brown. 42% present with mental health issues from the most passive to the most aggressive. 36% of my female population is dual diagnosed, meaning that they suffer from both mental illness and substance abuse. So when you talk about the cost of what it takes to run our facility, which is a 365-day, 24 hours a day operation, these numbers, although are what they are, it doesn't tell the full story of what it is that we have to do to get people back home. Now, they say that we're 48th or 49th insofar as incarceration across the country. But what they're not really, I think, intimately and adequately describing is the nature of the service that we have to come forth with to take care of people that have some severe mental health problems, have some severe substance abuse problems. This costs a lot of money, and the taxpayers are picking up that freight. Clearly, we don't want to be in a position where we're spending all of this money, where kids aren't getting enough money to go to school, and the MBTA is not getting enough money to transport people from here to there. But let me just tell you about transportation. When you talk about transportation, we moved in the year 2016 over 47,000 people across the Commonwealth to other county facilities, to state hospitals, to courts. Each time we move, and we moved over 18,000 people, we have to send 2 officers for public safety. That's not mentioned in this report. We have to send 2 officers. That means 2 people are now off of my campus. And as I said, this happened over 47,000 times in 1 year. Extrapolate that out across all of Commonwealth for all 14 sheriffs. There have been some great things said about the CSG, I'm sorry, so many letters here with all these reports that are coming out, CSG report. But here's the rub on that also. There's 14 sheriffs. They visited 6 of us. And the metrics that they use to quantify what it is that each one of us do was done differently. It's not fair, and it's not adequate, and it's not just. And then they followed that up with a questionnaire. And after they got the information back from the questionnaire, they did not come back again to see us. Once again, I don't think it's just and I don't think it's fair. That said, I agree that we do need to talk about how we are utilizing our resources, how we are working independently across our different agencies to get what it is that we need to get done. And I'll close by saying this. The hallmark of any vibrant community or any vibrant society is how we take care of the most compromised individuals in that community. And right now, it's people with mental health, and it's people with substance abuse issues that should be in a mental health or substance abuse bed outside of a correction facility. They should not have to come to a correction facility to get the services that they need. It should pain everyone in here to hear a parent say that they're glad that their child is in jail to get the services they need. I'm sorry, but that's just bullshit. At the end of the day, we are our brothers and sisters' keepers. If America is supposed to be the leaders of the free world, then let's act like it and take care of our citizens.
Thank you, Sheriff. I'm glad that you got excited this morning by the news. It woke everyone up. Forget the 7-minute stretch. We needed that. Chief Ryan from the Arlington Police Department has been a police officer since 1984 and has served as Chief of Police in Arlington since 1999. Chief, please come up.
Thank you. Thank you very much. It's a tough act to follow, Sheriff, but I'll do my best. Again, my name is Fred Ryan, and good morning to all the members of the Great and General Court and the DAs that are here today. I see a lot of familiar faces. I stand here as a police chief in my 18th year serving my hometown, the privilege of serving my hometown as chief of police. I also stand before you as a former juvenile offender, an example of where a system that invests in kids' success rather than failure can result in a successful outcome. Who's read The Other Westmore? Anybody familiar with The Other Westmore? For those of you who have not read The Other Westmore, please pick it up, go to Amazon and buy it. I'm The Other Westmore. The Other Westmore, briefly, is about two young men, black inner city, I think it was Philadelphia, they were inner city kids, Baltimore, sorry, and both with the same name, Westmore. Both living in poverty with poor education and all of the other consequences of their environment. One became a Rhodes Scholar, the other became a career criminal and is incarcerated to this day. And the point of the story is, one Westmore was given a second chance, and he became a Rhodes Scholar. The other Westmore never got a second chance, and his fate was sealed. I'm the other Westmore. I got a second chance and became a police officer, and now I have the honor to serve my community. And in serving my community, what I want to talk a little bit about is community-based programming. I lead a department now in which arrests are down and our Part 1 crimes are down 19%. Motor vehicle crashes are down. Our motor vehicle citations are down 12%. Our fatal overdoses from calendar 14 into calendar 15, we were having one fatal overdose per month in our jurisdiction. We rolled out some programming. I encourage you to go to pariusa.org or go to the Arlington PD website and see our plan of action. One fatal a month in 14 and 15. Calendar 17, year to date, in our jurisdiction, we've had 0 fatal overdoses. Thank you. And that's by a pre-arrest diversion program where we're investing in people's success rather than giving them a scarlet letter of labeling them a junkie or a felon or all these other terms that our society loves to assign labels. And so as we move forward and we talk about community-based programming, I think it's important to follow up on the sheriff's comments, and then I'll sit down and shut up. You know, a part of what this data doesn't show is the relationships among the various law enforcement and criminal justice agencies. And in Suffolk and Middlesex, the two of the most populous counties in our Commonwealth, the relationship building, the community-based services coming out of our sheriff's departments, and the networking that goes on from sheriffs to police chiefs on a daily basis to invest in people's success as they come back into our communities has never been more effective and more fluid than it is today. And I think, you know, while this data is important, we need to look at the qualitative measures as well. Thank you, and I look forward to having a conversation on the panel.
Thank you, Chief. And our final panelist is Dan Mulhern from who's Senior Advisor to the Mayor and Director of the City of Boston's Office of Public Safety.
Good morning. Before joining Mayor Walsh, I was a career prosecutor here in Boston. I was the chief of the gang unit for quite some time. I see some former colleagues in the audience as well. Most of you know a little bit about Mayor Walsh, but if you don't, I'll share maybe the Monarch Note version of him. He's a gentleman that ran for mayor, but up until his 29th birthday, probably made every mistake imaginable and was struggling with addiction, which led to him being in the back of police cars and ultimately to a detox and then into recovery. So understanding that is the context for which he ran for mayor, and that is the spirit that he's brought into that building along with him. So he becomes mayor. I move over to this newly formed position thinking, wow, this will be easy, just coordinate cross-agency and cabinet efforts to keep our neighborhoods safe. Having been a prosecutor and a bit of a linear thinker, I quickly realized that task was almost impossible, not because all of us in this room and outside of this room are not well-intentioned, And I most certainly have known the sheriff for quite some time and have not met a more committed public official who would be happy to not have a job, frankly, if he were as successful as he would like to be. So I came into the mayor's building, and about 6 months into my job, I asked, after going to meeting and talking about process, boy, can I just ask for forgiveness later and try to move some things forward. The spirit that we've been able to coordinate out of the office that I oversee, and the mayor having the courage to take the long view on public safety. There will always, unfortunately, be a role for law enforcement to enforce and arrest, and that's just an unfortunate reality that we're faced with. Here in our city, from 2007 to 2014, I just looked at a firearm recovery report. We have close to 5,000 firearms taken out of our neighborhoods. We, on a yearly basis, have somewhere in the average of 700 firearms taking off the streets of our neighborhoods, primarily in Roxbury, Dorchester, Mattapan. And so one of the other realities that all of us know, but I'll say out loud, is having spent a lot of time behind the wall and doing ceasefires and reentry work and prevention and intervention work, is that not one young person in our city raises their hand and says, boy, I want to be involved in gang violence, I want to be involved in crime in our neighborhood. And that also, to the chief's point and the sheriff's point, is an unfortunate reality. They want to do all sorts of different things. Let me talk to you a little bit about what the mayor has done locally. He's created platforms such as Operation Exit, which is a pre-apprenticeship program run out of the mayor's office, that we just saw some costs of incarceration. On average, for 20 participants, cost somewhere in the range of $56,000, $57,000 for that class. 100% guaranteed placement in the trade union post-graduation. We've graduated 3 classes. We're starting our 4th class on June 12th. We've expanded Operation Exit, this program, into resilient coding and culinary arts. There are a number of participants, I won't give you the anecdotal stories, but there are a number of participants that are talking about first-time home buyership. It's 100% previously incarcerated population. We've had 3 persons recidivate in a 2.5-year period of time. I see Molly in the front row from Roca, and there's a wonderful cast of folks in this room that are doing great work, but it requires all of us. It's not the sheriff's obligation or the chief's or the advocates in the room, but it requires public and private relationships and coordination for us to be successful. We just lost a large chunk of money coming to us from our federal partners. We don't anticipate that there'll be like-minded folks and money coming to Boston based on some of the past administration's efforts. To some, that is discouraging. To some of the like-minded people, that, including our mayor, it's all the more reason to double down on our efforts. I see our partners from the Boston Foundation and up in the front. They could not be a more consistent and relentless partner in the work that we're doing on behalf of the mayor, too. So I'm going to sit down, and hopefully there'll be some questions. Thank you.
Thank you, Dan. Okay, here's where we get to have some fun. Mass Inc. polling shows that the public thinks that connecting individuals to community-based organizations is one of the best ways to reduce recidivism. So currently, as you had said, we have lost some federal funding and some state funding. But how do we get these funds to these groups currently outside of maybe what had come from the government? Dan, yeah, please start.
There's 2 primary funding streams that come in from our state partners. One is called the Safe and Successful Youth Initiative that many in the room are probably familiar with, and the other is called the Shannon Grant Initiative. They're a little bit different, and this is the way that I'll best explain it so that everyone in the room understands. The SSYI funding streams are specifically geared towards those that might be at risk to be on one side or another of a firearm. the Shannon money that comes into our city and then comes into our city and then goes out to our community partners is based on that. To some degree, if you can distinguish that lower risk threshold of those that maybe haven't graduated to the assumption of risk that the SSYI money is targeted for. They come in, they're both administered through the Boston Police Department. SSYI originally went through our Public Health Administration, and there's a RFP process and grant process. That money, I would encourage everyone in the room, again, to speak to your legislators about enhancing the funding of both of those models. Molly has an interesting pay for success. Molly from Roca has an interesting pay for success model that is too complicated for me to explain to you all. But there is some opportunity, we believe, that will be coming in from the Department of Justice. We, on behalf of the mayor, are constantly chasing those grants, and we're constantly chasing the private sector partnership, philanthropic and foundation partnerships to bring money into our community partners.
Great, thank you.
So just I want to reference something that Danny said a moment ago. As a guy with a mortgage and 2 kids going to college, I need this job, brother. Okay? just want to put that one out there. But what we'd like to do is do this job a little bit differently. One of the beauties for me being a sheriff in the Commonwealth is that we really get to work in a social work capacity. We have policing rights, we can arrest, we often don't. But working in a social work capacity, that allows us to work with our populations. And to that end, in a different sort of way, and to that end, one of the things that we're working on is the creation of a 501c3 that will allow us to go after different pools of money so that we can then, once people are cycling out of our facilities, we can utilize those dollars to help those agencies, help the people that we need to put them in touch with. An interesting thing about being a state organization, when we write a grant, the state can take a percentage of that money, despite the fact that they haven't crossed one T or dotted one I, but they get to take some of the money, and that is what it is. I'm not complaining about that, but that 501c3 model allows us to keep more of that money that we bring in, and that way then turn it back around, put it back into the community, and put it back into the lives that we're trying to help.
Excellent.
And I would just briefly add, who's familiar with the concepts of restorative justice? Okay, great, awesome. So for those of you who aren't familiar with it, the traditional criminal justice system is, was there a crime? Who did it? What's the penalty? Under the concepts of restorative justice is, was there harm? Who's responsible for the harm? And how then do we repair that harm? And so my point is, through public-private partnerships, I sit on the board of the Communities for Restorative Justice. I know Roca's done a lot of work around restorative justice. But until you've had the opportunity, as I have, and I do it once a year just to recharge my batteries, to sit in a restorative justice circle and see a victim in the same room in a controlled environment with an offender, and to see the two of them have a conversation about the consequences of the offender's behavior, and the offender explaining, sort of what ignorance led them to commit their offense and what they've learned from the restorative process. It is among the most powerful experiences I've had as a law enforcement professional, and I encourage the members of the Great and General Court here today. I've worked with Rep. Garbely and Senator Eldridge on some legislation for restorative justice, and I think it'll be a part of the whole criminal justice reform package. It's unbelievable, and I encourage you to sit in a circle if you can. But that's through a public-private partnership in our jurisdiction.
Wonderful, thank you. Okay, so now, Sheriff Tompkins, let's go back to, I find the C3 concept is fascinating and actually, I think, a really good way to go and to channel this. How do we ensure that, one, there's the capacity there, and that, two, they're spending and prioritizing effectively?
Well, I mean, we have to work with organizations that would act as that fiscal agent as we are looking at the organizations that we want to work with. And clearly, we are looking at, first and foremost, We invite community health centers in to work with our population to match them up with a healthcare practitioner before they leave, so that once they leave, they have a warm relationship established. As they're going out that door and they're working with that social service agency, if that's an agency that has proven their mettle, that's an agency that we would like to invest in. When you talk about housing, when you talk about jobs and job creation, when you talk about education, we're looking at organizations, or we'll look at organizations that will work in all of those things that in the absence of those, people could recidivate. But we're also, and Molly referenced this, we're also looking at that 18 to 24-year-old cohort. And one of the things that we're doing at our facility is we're going to take one of our units and set that aside just for that demographic, so that we can have a different curriculum track for them. Once they cycle out, we want to be able to hand them off to entities. So when you talk about capacity, we want to work with agencies that have proven through data, and that's the buzzword now, is data and data, evidence-based data, proven that they can be successful. And we think this is a model that a number of entities are already using, that we'd like to jump on back of. And let me just say this also. I want to give a plug to former Sheriff Frank Cousins up in Essex County, who took one of his units and turned that into a detox unit, working with his judges and working with the DA there. If you have a low-level, non-violent offender, what he says is, instead of sending them to the jail side, send them to the detox side of the facility. And it's a 28-day program. When they come out, they don't have a ping on their record, if they have a record at all. And then they are handed off to an agency that has proven that they can have that continuum of care that Yolanda referenced. So that's what we're looking at when you talk about the 501c3 allocation of dollars and how we would utilize that.
Excellent, thank you. Would either of you like to add anything? I know you were talking about the SSYI and the Shannon funds, about how do we make sure that we can get those funds, that they are funded, that we can then get those funds, and that the right fiscal controls are in place to make sure they're helping the right populations.
So again, everyone, most well-intentioned folks in the world, but we found that when our mayor came in, he was pushing very aggressive for accountability and transparency. So we restructured the governance model for SSYI and Shannon to make sure that we were having outcomes reported, so we understood whether or not agencies were doing what they said or proposed to do. Again, only because Molly's very close in the front row, but I think Roca really has led the way in showing other nonprofits, very respectfully to any others that are in the room, about how to capture data and how to report it out. And there are great lessons to be learned from that. Again, best of intentions, but it's really important to be able to show the impact. I was just talking to the chief too, that it's worth noting we do use asset forfeiture, drug forfeiture money, and at least in Suffolk County, that process half goes to the Boston Police Department, half goes to the prosecuting authority, which is Dan Conley's office, and then there's a community RFP process where that money is reinvested back into the neighborhoods post-arrest. So it's another reinvestment model that has been in place for some time, and I'm certain it's in place in other jurisdictions as well.
Okay, thank you. So building off of that, so again, going back to grants not being funded, so the funding for the reentry and other evidence-based practices has mainly come from the time-limited grants. So we all know that we can't have money just coming forever. It's going to end at some point. Knowing that happens, why has it been so difficult to get sustainable funding long-term? And what has it meant in how many people that we can help out?
Maybe I'll just chime in. So for the first time, I didn't mention this either, but for the first time, the mayor is opening an office of returning citizens. It's never been in place in the city of Boston out of a mayor's office. The space is currently being built out, and we hope to be up and running and staffed in July of this year. The idea behind that would be to coordinate all of our reentry efforts, both with the sheriff's participation, our federal partners, and state partners, and we do believe that we'll be able to carve a slice out for our DYS partnerships as well. The mayor also specifically allocated in the city's budget a a significant cost to fund that we hope will be part of the budget for years to come without the need to rely on outside forces.
And I would just add, get back to data, right? So we were one of the original municipalities that embedded a mental health clinician into the police department using the co-responder model. And at the front end, thanks to some great work by my staff, because all this stuff is over my head, but we really put some good data collection systems in place so that now, just this year in the municipal budget, we're able to request and get funded through the municipal budget additional capacity so that we have coverage in the evenings and weekends with a mental health clinician responding in the field and managing people that are in mental health crisis and getting them into the healthcare system rather than a jail cell at the local PD. And so it's good data and be able to justify the impact of the quality of life in the community.
Wonderful. Thank you.
Yeah, I was going to say the same thing about data. A lot of these entities, these granting organizations, are looking at how successful or not whatever that initiative is. But I just want to reference something called a BRI, and some of you may know of the Boston Reentry Initiative. And the city of Boston did lose some of that funding, or I think all of that funding this cycle. But all of the partners, you know, the mayor's office, the DAs, the attorneys generals, and so on and so forth, and the sheriff's department, we have all still banded together in the absence of those dollars to keep that initiative going forward and then reapply for those monies the next time out. So if the money stops, we have to then find innovative ways to continue the services that we're trying to bring forth.
Great, thank you. Okay, Mass Inc.'s report calls for directing funds from corrections into the behavioral health systems. We've made improvements to the treatment system over the past few years, but still, as we could see, there's a lot to do. Is the lack of treatment services in your community still leading to avoidable incarcerations?
I'll jump in first on that. So we also, the mayor didn't tell me to come here and be his cheerleader, but I'm going to anyway. So for the first time ever, the mayor created a mayor's office of recovery services, never having previously existed in the city of Boston, specifically to deal with those behavioral dual diagnosis or addiction and mental health issues. We also just recently, most folks in the room are probably familiar with Section 35, the mental health statute. Law enforcement, as the chief well knows, can be a petitioner. It doesn't necessarily have to, coming from a complicated family myself, it doesn't have to rely on a family member to be the petitioner in the affiant. And we just did some cross-training of, everyone's aware of what's going on around the Boston Medical Center, but our commissioner specifically designated a bike unit there, cross-trained them on Section 35, 123 Section 35, and we're in the process of piloting a streamlined process for the Boston Police Department. Instead of introducing them into our jail cells or to the sheriff's building, but to petition for civil commitment around addiction being a danger to themselves or others, with the hope of getting them into long-term treatment. But the beds that I think Ben mentioned are a constant challenge. We hope to stretch those beds capacity with this new effort from the police department.
And I would, following up on Chief Justice Gant's comments, argue that it requires people to exercise some leadership in their jurisdictions. You know, it's so easy to say we don't have the resources, can't find access to treatment, this and that. We said with the opiate, listen, I want the bodies to stop turning up. We can put up self-imposed barriers to success, HIPAA, the public policy that'll harm more people than it ever helped, and and all these other excuses and self-imposed barriers to success. We affiliated with a private nonprofit. We now have access to over 200 vetted treatment providers nationwide, and that didn't cost anything. We just had to establish a partnership with a private nonprofit that vets out these treatment providers. And for some reason, when the police department calls and said, I need somebody in a detox or in long-term recovery, there's a bed for us. So again, I would just argue that we're too quick to put up self-imposed barriers to success, and we need to exercise some leadership.
One of the things that we're doing at the Sheriff's Department is when you talk about our staff to inmate ratio, We also have about 12, 13 people just in our mental health area. We have about half of that number in our substance abuse area. And so the individuals that are in our department, I have about 1,000 employees, they're not just all officers. If you look at a facility like mine, everything that goes on outside the walls goes on inside. It's like marshaling a small city. And so we had to increase the number of mental health practitioners and substance abuse practitioners so that we could really more effectively help people. And when I think Yolanda referenced, when an individual comes in, they go through a classification process. And we put an ISP or an individual service plan together that speaks to what type of services are going to be needed for the entirety of their stay. And so we're trying to eliminate what does not work and enhance what does work. And I'll close by saying this, that we're working with our legislators, and Senator Brownsburg is really being a champion on this, with getting a central lockup that would service the entire county. Now, we don't have to ask the Commonwealth for money for a building because we already have a building. The thing here is when the police pick up an offender, instead of taking them to the district office, they can just drop them off right at the sheriff's department, and we can take them from there. The point being is the earlier that we can get in front of an individual or get that individual in front of us to tell us about their needs, the quicker we can service them and help them out with whatever those needs require.
Wonderful. Thank you. Okay. Without reliable data, it is difficult to make the case that recidivism reduction programs are working. It is also difficult to write performance-based contracts. Getting good data and system in place has been a real struggle. So what more can be done?
Well, in Communities for Restorative Justice, we did a 10-year look back on juvenile offenders that were diverted pre-arrest into a restorative justice setting. We had a 16% recidivism rate. And I think in the traditional criminal justice system, it was in the high 30s. So the data is clear that investing in kids' success via models like what Roke is doing and others, pre-arrest, pre-arraignment, is extraordinarily effective.
Here's a big the red stop sign. Do you all want to add one last comment then before we'll do our little lightning round?
Well, quickly, what I'll say is this. Although this report and the CSG report and the PCG report and all of these reports have come out to talk about what we're doing, I do believe in transparency. I do believe that it is beneficial that folk like yourself and others, particularly legislators that have jurisdiction, at least in my case, over our financing, understands what it is that we're doing, and we can work closer with them to make sure that those dollars are being spent adequately and not just kind of blown off into the air. So I want to thank Mass Inc. and the others for working on this and putting this together and convening us, getting us all here so that we can really talk about this in a way that is going to have some impact.
Great, thank you.
Thank you. And yeah, again, thanks to Mass Inc. and everybody who's here today. You know, transparency breeds self-correcting behavior, right? And therein lies the importance of transparency. And, you know, we work very closely with the Middlesex Sheriff's Office and Sheriff Katusian, and some of the programming work that has a nexus out into the community to help drive down recidivism is that qualitative stuff that I talked about that I think really needs to be analyzed because it's so important to our community to drive down crime and enhance the quality of life in our community.
And I just like to, Greg, thank you in particular in Mass Inc. I think that the more that these rooms come together, there's so much more to talk about around sentencing reform and other things that we're all discussing, front-end reforms that prevent us from the back-end conversation around reentry. So I just want to thank Mass Inc. very much for having us.
Thank you all very much for being here today, and thank you for listening to this panel.